Hey, Margie here. Are you ready to learn about some new things you can add to your home exercise program? Well, if so, you are in the right place because I'm so excited about today's episode with special guest, Dr. Sherri Betz. And Sherri was a guest back in November 2019. And it was actually one of the most popular podcast episodes talking about optimal exercise and osteoporosis. And today she's come back for an update and as well as giving us some new ideas and new things we can add to our home program. So Dr. Sherri Betz is a physical therapist and Pilates instructor, and she specializes in osteoporosis, geriatric orthopedics, and mind-body exercise applications for rehabilitation. She's the director of TheraPilates at Physical Therapy Clinics in Santa Cruz, California, and Monroe, Louisiana. And she's a frequent international conference presenter. She hosts streaming lectures, bone safe movement classes, and webinars. And I've known Sherri for many years, and she is the person who teaches the physical therapists, the doctors, the healthcare practitioners about the importance of exercise and osteoporosis. And she's increased the awareness of what exercises are safe, what are dangerous. So she is just full of information, and I love her exercises, and she's just full of so much positive energy. So really excited. In the episode, we're going to talk about, in the episode, she really presents some great exercises, some great equipment that you can use at home that will make such a big difference. And she's offering a free week of her program that she explains with all sorts of videos, and it's really great. So I'm so excited. Enjoy the episode. Welcome, Sherri. I'm just so excited to have you here on the podcast. And we're going to share about home exercises because so many of us are at home and there's so much that can be done to improve our bones and overall health. And you are really one of the experts on this. So thank you so much for being here today.
Oh, thank you. I'm excited to be here. I'm always happy to share healthy bone strategies.
So in terms of being home, what apparatus do we need, or what kind of equipment can we use when we're home if we don't have access to a gym?
Yeah, I just love having people not buy anything for their exercise program. I just want to have you use the things that you already have at home, and I think you can build your bones and strengthen your body without any fancy equipment. But I will share some things that I like, but really the basics, okay? So the first tool that I think everyone needs is a broomstick. And I can't teach any class without a broomstick because it works as a balance tool. It also works as a spine alignment tool. And that's just my favorite for being like a portable wall. So, you've probably been told to stand against the wall to help your posture. But what happens when you come away from the wall, right? So you have this portable wall here. You can put your thumb in between the stick and your low back. It should be pressed firmly against your tailbone, maybe your mid back and your head, depending on your spine alignment. And then you can practice bending and hinging at the hips, and then see if you can actually touch the floor, right? And then you can also stand with the stick right beside you, working your balance. You can do all kinds of really fun exercises to challenge your balance. You might do some dynamic side shifting, and those, it's just such a great tool just to make sure if you were to trip and it's there, you need it, you can also pick it up 1 inch off the floor and practice your balance, with it picked up 1 inch off the floor, put it down as you need to. So it's just there as a little bit of a safety measure. And I just love that. So that's great that you can use that. The next tool that's one of my favorites is either a roll of towels, right, or a ball. And this is just a kid's ball, right? Nothing fancy. That I generally don't like people to lie on something that's not designed for massage. So these are massage balls. And I did not bring my towels out here to roll up, but let me grab them so I can show you, because I wanted to show you something that you could do right now. And I have them right here.
And for those people who are just listening on the podcast, this will be on YouTube, so you can see these. You can also see the pictures as well.
So these are just full-size towels folded in quarters. And then so basically just verbally, take a big towel, just a bath towel, fold it in half again, stack it on top of another one. So do that to 2 towels, stack them up, and then they'll be about 12 inches long, and then you roll them up real tight, and you just make this big lumbar roll thing, right? And then you place that on the floor and put it behind your back. And then you lean back, and it's become a thoracic extension device and an abdominal strengthening device. It's like the crunch replacement and the thoracic extension, arching back and just coming up, just watching that you don't pull your head forward, that you keep your neck lengthened. Your eyes are looking at either the top of the door frame or the crown molding, and at the ceiling, and then at the wall behind you, and then curling up, ribs to pelvis. And so it just makes this wonderful tool that you can put anywhere in your back and start to arch your back. I kind of developed this when I was starting to teach during the pandemic, and nobody had any supplies, right? So we had to come up with household things that you could use for your exercises. So I love that one. The next one is just a pillow to put under your ribs that will help you with thoracic extension that I usually do to follow that exercise. So you're placing your hands under your forehead, you use the pillow to protect your lower ribs, and then you lift up. If you're having a hard time with that, you can place one hand down on the floor and use some assistance at first to lift up. You can place your hands in a goalpost position and lift, and then do your sort of rotator cuff action here. And you can add weight as you get stronger. And then you do the Pilates swan or cobra. And then making sure that you lift your hands up, which you normally don't do doing the Pilates swan or the cobra. Lifting up like that. And so that's super simple. One other little tool I love
These
is
are also inexpensive, which I love.
Yeah, dog leash. So a dog leash, bathrobe belt, necktie, sleeve of a sweater, whatever. You can put it underneath your low back, and then make sure that you're doing your abdominal exercises correctly. Take your strap, place it around your belly, right in line with your belly button, lower the strap down, and then slowly press your pelvis. So I'm not going to really, tuck hard, but I want to press my low back into the strap so that engages my abdominals. And then I tug on the strap, make sure the strap is down. And then I can do my abdominal exercises and know that I'm doing them well. Because normally when I'm with the patient, I have my fingers under there and I can see if they're arching their back. And so you can practice doing your abdominal exercises with your head down and your back flat. Now, sometimes I find that people's necks bother them when they're doing those, and you can just put a pillow under your head. So if you just prop your head up just a little bit, even by just rolling this mat up a little bit, it makes a big difference in easing your neck. So just don't be afraid to put a little pillow under your head if you're having a hard time with some of those Pilates core exercises. So that is great. And then you can also do a hamstring stretch and sciatic nerve glide with the strap, and then doing some big muscle stretches, also adding the flossing for the sciatic nerve, which I love to do in my classes, because so often people have chronically tight hamstrings, and it's usually not the hamstring that's the problem, it's the sciatic nerve kind of getting caught in that pathway, trying to get it freed up a little bit. So we can have a whole podcast on that.
No, that's really.
I have one more favorite, and that would be the box. And just a plain old file box that you get at an office supply store. And you can put weight in it. So you're going to start with, say, 5 pounds, maybe 10 pounds, about the weight of a laundry basket or a grocery bag. So you don't want to start with too much. You also want to make sure you have shoes on when you do this. Let me go ahead and put my shoes on because I don't want to break my own rule here. You don't want to drop any weights on your feet when you do strength training. You always want shoes on because you do not want to drop a weight on your foot. And then you can straddle the box and practice your hip hinge. And the reason why we want to be able to touch the floor so that we can pick this box up. And we have to have enough hip mobility to be able to do that. So the box can be just perfect for building bone in your hips and your spine. And it's just a great resource. You don't have to have a barbell. I do have one back here, but you don't have to have a barbell to get started with this. You can work up to maybe even 30 to 40 pounds, because a full file box is going to weigh a lot. And so you can work up to lots of weight in here. I wouldn't say more than 30 to 40 pounds in your box. Then you can transition to a barbell. But by the time you have built up to that, you'll be ready for that in the future. So it usually takes, 3 months or so for people to build up on their weight. And you don't want to rush it. So I always say, give yourself 3 weeks to start feeling the effects of strength training. You're going to be really sore the first week. Second week, you're going to be like, oh, is this really helping? And then the third week, you're going to be like, oh, this is getting a little easier. So usually about 3 weeks into it, doing 2 to 3 times a week with your strength training, 2 times a week minimum, 3 times a week maximum, always leaving a day in between. And then you should have a good program. But those are my favorite little toys to use at home that you don't really need to go anywhere to purchase, right? You don't have to go to the gym and you don't have to order anything.
So Sherri, the last time you were on the podcast, and I'm going to have that episode for everybody, because we went through all of the precautions and things that you need to take and poses to avoid and what's important. But things have changed since then. You've added some things to your yoga and Pilates program. You want to share how what you've added? Because I think it's so important for everybody.
Yes. Well, I was doing a kind of yoga intro where we did some balancing poses, yoga poses. I always did the hip hinge, the chair pose kind of things. We did some warrior poses and things like that. And then we went onto the mat and we did a bunch of core work, planks, side planks, and abdominal work, and then the back extension like I showed you here. But in 2018, Benedetti published a trial that I got wind of, probably not a trial, but a systematic review where they reviewed a bunch of different randomized trials. And what they said was high intensity strength training was going to be best for building bone. And then future trials came out that said high intensity strength training was better than just Pilates. So I thought, okay, I got to make some changes. And how am I going to do that in an easy way, especially with people at home during the pandemic? Because it was about in 2019 that I started making these changes. And we added the box training, lifting. So always wanting to do a deadlift. That is the best thing ever. And a deadlift is just picking something up with your arms straight and standing up. If you can bend your elbows, it's too light, right? So that would mean that I'm lifting a barbell. So I am teaching my groups how to lift the barbell. And I have people of all ages, and we are practicing with good technique and alignment. I'm watching their form, and they're picking up the barbell. So that would be something that I've added. We start with the box lift and then progress to the barbell when people feel like they're ready. And then I've added weights with heel raises, weights with lunges, right? And a bit more dynamic movement. And let me give you an example of that. So I call it my start the lawnmower exercise. So, my toys out here. And I use a TheraBand and step on the TheraBand. And then we're going to start the lawnmower, right? So I've got lots of load on this front leg, and then I'm working my back. Then we add to it, when you're ready, lifting one leg, right? And if you don't feel comfortable with that, you can use your dowel, right? So you can step on the band, and then, so I've kind of amped it up a little bit, especially for my people that have been with me for a while. And, it's people like you and me who are pretty strong that need to still challenge that bone, right? And challenge that muscle strength, because if you're not progressing, you're regressing. So I try to come up with.
That's such an important point that I think so often, people are using their 2 pounds for 2 years or 3. Right. That's not going to be enough stimulus for your bone. And that's what the research has shown. So you do need to keep progressing. And I think that's such an important point to really share with everybody, because a lot of times people will think they're exercising, they're walking 20 miles a day and they're doing weight training, they're doing a few pounds. but in reality, it's not enough. And so I think that's why
Yeah.
it's so
There's
important that each person's so very different.
right. And there's a really easy way to know if you're targeting bone or you're targeting more endurance cardiovascular strength is if you can do more than 10 reps of anything, it's probably not building bone, right? So I always say target 15 reps. Once you get to 15 reps, you know it's time to go up on the resistance. And it kind of keeps you safe too. Make sure that you can at least make 8 reps, and then you're going to target 15. If you can't do 8, easily, or it starts to hurt or burn too much, or, you just feel like you're going to fall down, right? Then you stop, right? And then decrease the amount of resistance and keep it between 8 and 15. So, minimum 8, maximum 15. If you can do 15 to 20 reps of anything, it's too easy to actually build bone. And it's going to be more of an endurance exercise. That's why cycling, most of the running studies, it's a little controversial about running, but most of the, walking, cycling, the gym equipment like elliptical trainers, the Stairmaster, the bicycle, all of those don't actually build bone because they're hundreds of repetitions, right? And especially if you're sitting and then doing hundreds of revolutions on the bicycle, that's not been shown to be beneficial for bone at all. And actually, it can be detrimental for bone. So,
Yeah,
if
no,
you
that's
keep it
interesting
between 8
how,
and 15, that's a great
yeah,
range to stay in.
those are great guidelines. So Sherri, you have this amazing program and I've been doing it. And I really want you to share it with all of the listeners because this is possible. And you never used to. I mean, this is so one, there's always silver linings to things. And one of the silver linings, I think, of the pandemic was that you, instead of doing live classes, and you used to have videos, you had videos, DVDs or whatever, but
Yeah.
now you have live classes online. Why don't you share what you've created, because it's something that's available to everybody. And I just think it's incredible.
Oh,
And
thank you. Thank
yeah, I
you.
love it. So I'm really excited for you to share what's possible for anyone, wherever they live. You can be in another country, it doesn't matter.
Right. I know, that's been so much fun. It was interesting because I got put on furlough at the hospital. They closed the outpatient clinic during the pandemic. And I was like, okay, I better do something, right? So I started creating a Zoom program, which I kind of already wanted to do anyway. And
Can I just say something funny? The last
yeah,
time you were on, which was in, was, I think, it was before the pandemic. I think in
November
2000.
2019.
Oh, is that the last time? So in November
Yeah.
2019, you had mentioned that one of your goals was you were going to take your videos and put them online.
Yes. Right. And it happened. I did it, but I think I
Yay.
was pushed to do it a little bit. I had that little push from the universe. But yeah, so I started creating the Zoom classes. We did our first Zoom class. Michelle and I did it together. And it was free. And we just were like, let's see if this works. And it worked. And we had like 30 people that showed up. And it was all our old clients that I haven't seen in a while. And so many people came back into the fold. And we have been going gangbusters ever since. It's so much fun. It's one of the best hours of my day. We have a class every day. And if the timing doesn't work for you, we actually upload all the classes into our video movement library. So if you can't make the live class, you can take one of our recorded classes. I put all of my classes that I teach in the library. And then I usually put like one a week from Michelle, one a week from Jenny, the other teachers that I employ. And that way you have access either way. And we're also offering the Happy Bone people.
Yeah, anyone who's watching, anyone that's watching this podcast, Sherri is being so generous. So explain what you're offering.
Yeah, I'm offering a free week to join our live classes and get access to our movement library. So you can kind of experience what we have to offer and no risk. You just show up and enjoy. And all you have to do is when there's a promo code that shows up when you sign in, and if you need help, you can email me or let me know. And you put in Happy Bone, and that's the promo code.
Yeah, and you know what? You created a great video about this. So I'll have the video, the link, so that they can really understand exactly how to do it, and it walks them through it. But the other thing that's so incredible is all your videos and your DVDs are in there. So you're safe. Yeah. You have 2 that you created that are amazing on safe yoga, safe Pilates, that really goes through what do you need to do from a regular program to make it safe. And I
Yes.
think, the modifications, a lot of people just aren't aware of. But as a physical therapist, you created, how can you make it safe, not only safe, but really reducing extra forces on the knees and different areas,
Hmm.
the alignment. So
Yeah.
it really is an amazing program. And I'm
Thank
just
you.
so excited that you're sharing it with the community, because it is that special, and it's a safe program for people if you're looking for something at home. And the other thing that I think is so great is you go for someone who's a very, very beginner, you start at the basics. So you'll have the
Hmm.
Pilates for a person who's not able to lift and just needs alignment work. So there's just so many. How many classes? Do you have any idea how many you have in there?
There's over 100. I started trying to count the other day and I lost count, but I think there's over 100 classes in there. And one thing, under the physical therapy section, it has all my intro classes. So it has like breaking down the basics so that you can really understand the language and what's expected in the class, what props you need, and all that. So I do use a lot of props that are just like TheraBands and balls and things like that, easily obtainable. And yeah, and so if you need help guiding, getting guidance through the program, I'd be happy to help you. And yeah, I'd love to see more of your folks. It would be great.
Yeah, I mean, I just can't thank you enough, because I just love the way you teach. It's safe and it's fun, and people people see results. You want to share some results you've seen? Because I think that's important for people to know that this
Well,
does work. This
yeah.
actually, this exercise piece is a huge proponent. It's just a huge component of any program, and people have really made tremendous gains. So what have you seen just in terms of your clinical
Yeah.
experience?
Well, over the years, I've seen anything from 1% to 15% in bone density increase. But just last week, I had two patients who are in they're not my on-site patient or, physical therapy patient. They just take my classes, and they've been regulars for the last year and a half. And they got their bone density checked, and both of them saw an increase in their bone density. And one of them is in their 70s, and the other one's in her 60s. And they're so excited, that they are getting stronger. Their back doesn't hurt anymore. It's like I want to help everyone be able to exercise, get pain free. That's the first goal, is that hurdle those barriers to exercise, because you've got to deal with the painful situation first, and then progress to doing the loading and the bone loading, because you can't really do bone building exercises when you're in pain. So you really have to honor that and figure that out, find a good physical therapist to help you, or get in a really good class, because my goal has been to not see people in PT. Like, can I do a good enough exercise class that I help you address what's weak, stretch what's tight, realign things without you seeing me in PT, right? Is it possible? And I've seen so many people that just have gotten rid of their knee pain, got rid of their back pain, their hip pain, neck pain, whatever it is. There's one lady that said, I have had such bad neck pain. And so I really watch her when we do exercises that affect the neck. And I've been giving her little extra pointers in the class. And she said it's been like miraculous, because her neck is so much better. She didn't realize that she was moving her neck in a compressive way during exercise. And she didn't understand that she was doing that. She thought it was the way she was sleeping. I'm like, probably not. But yeah, so
Wow.
it's just really fun. It's sort of an adventure for me, and an experiment. I see people as like an experiment in a way, and see if I can get great results with them with as few sessions as possible.
Oh, I
I
love
went to the
this.
weather yesterday.
And it sort of fits in with what I believe about osteoporosis, that instead of looking at it as, oh, this dreaded diagnosis, you look at it as an opportunity to look at your life in so many different facets: what you're eating, your food, your stress levels, but also your exercise, and what are you doing? And most people haven't really evaluated it like that. So it gives you an opportunity, if you were a couch potato, to all of a sudden now become an exerciser for life, and you feel better, you have more energy, and you can do more in life and really enjoy the rest of your life so much
Right.
more. So that's what's possible. And I just thank you so
Yeah.
much for offering this to people, so that they don't have to invest anything. You can try it. If it resonates with you, if it's the type of program, then you have it available. So Thank you so much, and I'll have everything in the show notes. Well, we could talk forever because we could talk for
Yeah.
hours and hours, and I always love spending time with you. Is there any last minute thing you want to share with everybody?
Just to thank you for this amazing podcast that you've created. I think it's a huge commitment to have 100 podcasts on there. That's
Yeah,
incredible.
it's actually a
And
hundred
I
and
just thank
yeah,
you.
I think it's 100 now. I think this episode will be 115. So yes, yes,
Wow.
from
Oh my gosh.
yeah, I think you were episode 18, and I'll have the other episode because you gave so much great information in that, and we have handouts that you've created, the links to those also. So lots of great stuff. But yeah, it's just, we want to get the information out. Or both of us, I know, are committed to helping as many people as possible, and we know that it is possible. So again,
Yes.
thank you so much. It's been such a
Thank
pleasure, Sherri.
you. Always. Thank you, Margie.
I hope you enjoyed my interview with Sherri as much as I did, and now have some new things to add to your home program. Make sure to take advantage of her free offer because her program is really terrific and it's full of all sorts of fabulous classes. I will have everything I talked about in the show notes, all the links, as well as a link to her last podcast episode. So thanks again for tuning in, and I look forward to seeing you on the next episode.